go.
Okay. Hello, my name's Mark Giembycz. I'm a professor here at the University of Calgary, and I'd just like to tell you a little bit about what I'm working on here in my lab. So I'm a pharmacologist by training, and research that we do here really focuses on trying to understand how existing drugs and new drugs in development actually provide clinical benefit in diseases such as asthma and chronic obstructive pulmonary disease, which is loosely describing diseases such as emphysema and bronchitis. It may seem bizarre, but even though drugs companies make drugs and they're effective in individuals, many of them seem to work without us understanding the mechanism. So a lot of the work we do is trying to actually pin down how these drugs work in the hope that we can make new drugs, better drugs in the future.
Yeah.
So there are two broad classes of drug that we use in asthma and COPD. There's steroids, which everybody knows about, and there's something called combination therapy, where you add additional drugs onto a steroid, and there's some form of mechanistic interaction between the steroid and these add-on drugs that causes a synergy, and patients do better on the combination rather than the steroid alone. But we haven't the foggiest idea what that biochemical mechanism is. So we've spent, I suppose, 5 or 6 years trying to pin down biochemically how steroids work and how these add-on therapies actually enhance the benefit of a steroid.
Okay.
I mean, the Lung Association, like charities in general, are very important. Without getting sort of too political, funding for research across the board is difficult to get, despite there being very important questions to ask and problems to actually solve. So the Lung Association contributes enormously within Alberta, and I think many of us would agree without much hesitation that some of the research would suffer without the Lung Association's input and support.
Now, can you talk about, I guess, what you would do if you had like unlimited funds? If you had the ability to have unlimited funds, what would that mean for you, and how, like in terms of your work here and your staff?
I think that's the key question. It's the staff. I mean, most researchers don't need or don't probably want unlimited funds. What they need is sufficient funds to address the questions that they sort of cherish. So we have a number of important questions that we want to answer, and what we need are sufficient funds to actually interrogate those questions. So that if we had additional funds, there are several ways that most of us would probably go forward to enhance the expertise within the lab. So you can tackle a problem from different angles. So you can bring in people with expertise in chemistry, physiology, biochemistry, immunology, who share the same interest but come from it from a different angle. So you basically work as a team. So to swell the numbers with individuals with different expertise would be a primary objective of mine. And the hope, of course, would actually be able to address the problem very, very clearly and arrive at an answer more swiftly. Hi, I'm Mark Giembycz. I'm powered by breathing.
Perfect.